Right, we should be going live any second now, Cam. Alrighty. G'day, Cam. How you doing?
Great, thanks, Yianni. Great to be here.
That's awesome. Thanks for coming along again. It was, I'm just noting that the last time we had a chat online, it was through the Reimagining Healthcare podcast, and we're finding out a lot about more the technology around what you're involved with. So I'll make a reference to that in the show notes for people to actually have a listen to that one. That was episode 28 in Reimagining Healthcare, and they can get into a little bit more detail around the tech. But today, we're going to find out a little bit more about you and what's driving your mission, Dr. Cam, and where you're heading with some of the education and some of the support for allied health practitioners in understanding and applying personalised healthcare. So I might just open up by asking you to introduce yourself and tell us a little bit more about your healthcare journey and your background. Over to you, mate.
Thanks so much. I really appreciate it, Yianni, and it's really wonderful to be here again. For those of you who haven't seen anything or heard of me before, my name is Dr. Cam, and I started out with a pretty healthy kind of family situation, and I naturally liked sports, so I decided to jump into exercise physiology because it had health and sports in the title. And as I got through that in third year particularly, we were talking about reversing diabetes. And until this point, you know, I liked the study, I liked the environment of university, but I hadn't really given much thought to what next. And this lecturer particularly spoke about how you can reverse diabetes with exercise. And I started getting very, very interested in eliminating chronic disease. And that really started my trajectory forward. So from that moment on, it's never made sense for me for people to not do the thing that's right for them, but I now understand a lot more about why they don't do the thing that's best for them. So I got so interested in that I then went into a master's in dietetics because I really wanted to understand more about the food and how that might be able to help this metabolic issue. That was a bit of a split decision at the end of my fourth year. So I went into 2 years master's at Griffith University, and after that, I got a job at the Wesley Hospital on-site dietitian, clinical dietetics, and also working in cardiovascular rehabilitation as an exercise physiologist. So I got to see a whole lot of the end game of chronic disease and what it creates. And it occurred to me that I could do a lot more benefit out preventing these things than fixing people or trying to get them to fix themselves once they've had their chest cracked open and had a lot of invasive procedures that are being done to them that were preventable. And so I embarked on my PhD looking at reducing chronic disease factors in relation to breast cancer and after breast cancer treatment. So I was looking at nutrition and exercise and a 12-week intervention with 50-odd females that went through that. And while I was doing my PhD, I went into private practice where I was doing athlete performance, I was doing chronic disease management, I was doing any manner of things. And I really loved the work. But what I found is I was reading a lot of information, applying it, and not everyone was getting a result. It actually started getting quite frustrating that some people were there for 2 years with me and they weren't budging with their weight, or they weren't getting the results or the returns that other people were doing exactly the same thing. And that really got me thinking that I need to do more. And so I started looking at genetics, and then I found epigenetics, and very fortunate to find the CEO of Ph360 at that time, who had in 2014 launched the very first epigenetics-based platform that was looking at how you can understand an individual, what their genes are expressing right now, and then what we can do off the back of that. And so for the first, there was virtually no education around this stuff at that point. There was just a platform that had been developed over the previous 12 years, looking at thousands of people and how they respond to different things. And I was fortunate enough to pioneer the use of that platform in Australia and globally as an allied health professional. And all of a sudden, my clinical reasoning and why I was doing things, and even having to free my mind up from having to think about all of the clinical rationale, the platform was actually able to take over a lot of that, be very, very specific with nutrient requirements, with exercise timings, with even how this person was going to be motivated. And so it really lightened my load for calculating things in my mind while I was going. And it allowed me to free up a whole lot more space in my mind for how I can support the individual in front of me, because that's our job. And that's ultimately what I see as health professionals' jobs, is to provide them the knowledge and the support to maximize their health and bring them a life of health and happiness that they want. And I was able to do that a lot more because there was far less clinical decision making that I needed to make, because I had all of this incredible personalized data. That meant whatever advice that I was coaching them to input into their lives was going to be accurate for them specifically, knowing that everyone's gene expression is actually different. And so, I fumbled through 50 odd clients, and then was able to put a whole lot of that together into some health professional training materials. And since then, I've been educating health professionals around the world. We've been fortunate enough to just launch into Asia, the US, the UK, after a really strong start in Australia and New Zealand over the last 5 years. And amongst that, I've been working in corporate wellness with this information, with personalized learning and schools. And so now I'm fortunate enough to hold the position of the CEO of Ph360 Australia, and really supporting a team of individuals that are supporting a large community of health professionals to essentially provide a better result for clients, and a more consistent result for clients, through a number of different things. So it's been a really great journey. And I guess the big piece here that I would love to just touch on, and I might just share a couple of slides before I throw it back to Yianni, and that is just around the non-responder piece, and just going through why we do what we do. And I kind of mentioned this before, is providing individuals that happiness. There's an incredible amount of disease that we go through, and what creates great performance also is influenced by the healthy lifestyle. And we have these population guidelines. What I realized, whether it be nutrition or exercise or psychotherapies or medication, there are generic guidelines that are provided to different people. And what pops out of that are these non-responders. Non-responders are people that don't respond to the given treatment, and you will have clients like this. It is much higher than the 10% indicated here. You will have clients that don't seem to respond. And this was the thing that really triggered my motivation as to why I needed, how I could support people better, because it's rife within definitely my industries that I've worked in, that if a client isn't getting a result, it's due to lack of adherence, or not enough patience from the client's behalf, or not making enough change, or they're not motivated enough. We put a lot of responsibility onto the client as to why things don't work if you've provided what you think is the best program for them. And if they don't get a result, we always put a bit of blame on them to say, hey, it's not you. But then you look at a lot of the data around non-response, and what we see is that if you take LDL cholesterol, now, irrespective of what you think of these medications, they are very effective at reducing LDL cholesterol. However, some people will not respond. They won't get a result. And in fact, their LDL cholesterol can still increase. We have this high response, low response. We have the same thing for carbohydrates that we eat. Some people won't respond at all to the same carbohydrates that make a person respond with essentially the profile of someone with diabetes. These are healthy individuals otherwise, but they have very different responses of glucose for exactly the same food. We also see it in physical therapies and manual therapies where, for example, whiplash is a great one. 70% of people will still have moderate to severe symptoms 12 months down the track, whereas other people are mild symptoms for 12 months. Other people are moderate for 3 months, then mild for 12 months. There's a response rate that differs with people. And CBT is one of our most known psychological tools, and 35 to 45% of non-response rate is normal for CBT. So that's almost a flip a coin as to whether this therapy is going to work or not. And this is why psychologists have multiple therapies in their back pocket to make sure that they can accommodate what a person is going to need. But it's important that we understand that irrespective of the industry, and we have a systematic review on HIIT training here, if you do high volume HIIT training, only 30% of people are still going to get a result, or they're going to be likely responders, the green here. Whereas 35% of people are going to be likely non-responders to high volume HIIT training, which, you know, for many people for a while in the early 2000s was the panacea of exercise. And these are some results from an exercise trial using diabetes. So just this understanding that if we do exercise intervention, some people will improve their blood sugar levels and other people will not improve their blood sugar levels. And so this really confused me. It made it interesting, but also it made me really wonder, what are we doing? And so it was through that journey that personalization became a must for me. And this is very much where the paradigm that we're in right now. So we have this frame, and I'm sure that you understand it. There are people that don't respond to treatments, and this is where we're going now. We need to understand the individual so that we can be very specific to what they need and have a much greater result, and not allow this, you know, 35 to 40% of people, which sounds like a very high number. It is common to every, or not every number, but most trials, the average is 35 to 40% of people will not respond to a given trial in an RCT. This is something that we need to take account of, because people are coming to us with the question, what exactly should I eat? What exactly should I do for exercise? And so I guess that's the first part of the journey, is just understanding that this is a real thing that we need to pay attention to. And this paradigm shift to precision is mandatory for, you know, a very large percentage of the population who aren't otherwise getting a result.
Thanks, Dr. Cam. Look, there's so much that I want to ask you. I kind of want to organize my thoughts a little bit. But you're coming from being a health practitioner yourself, to moving into becoming an educator and supporting other health professionals with incorporating the knowledge that's come through the research and the science, and you've kind of developed a whole system here, haven't you, around educating what is personalized health. I guess one of the questions that I have, just leading into, I guess, the next stage in terms of the systemization and how you can actually support allied health. But is there a universal concept on personalized health within healthcare professionals? If we use that term personalized healthcare, do all health professionals relate to it and understand it in the same way?
Right now, I don't believe they do, no. Often you'll hear people say, I'll write you a personalized program. And what that means for them is, for some people, is I'm going to write you a program that is logistically possible within your lifestyle and your constraints and your preferences. So it's, okay, yeah, we've got to eat the guide to healthy eating. I'm going to get that in. I'm going to do it in a way that is doable for you. So there's a personalization to that piece. Definitely when we get into exercise training as well, there's personalization to, you know, the type of exercise that you provide for a certain effect. But there's still an understanding that if they've got this problem, like lower back pain with these things going on, then this exercise will definitely work. There is a personalization to that. And I would say that nutrition, they take into account things like FODMAPs and, you know, food chemicals. Similarly, psychologists take into account the individual variation of that person and where they're sitting right now and the factors that are going on in their life. But probably the piece that requires a lot more clarity is that when we're talking about personalization and precision medicine, we're talking about the understanding the genetic the profile of the individual, but also the gene expression. So not just what my body prefers. Look, the only time that I can exercise is in the morning, but your body may not prefer exercise in the morning, and therefore your personalized program that fits with your schedule, your social driven schedule, isn't necessarily what's best for your biology. And so this is a big problem, in that a lot of professionals are just saying, yep, look, we just need to get exercise into you, or we just need to get these foods into you, or we just need to support you this way psychologically, but it's not accounting for how is this individual made up, and how do we need to account for that individuality? That's a very, very big difference. And that's the conversation we need to have around genetics, gene expression, which is something that we can go into in a bit more detail if you'd like.
Yeah, absolutely. I think that's probably the way I relate to it is that everyone's different, and but there must be some, you know, common ground here, I guess. And maybe that's a good segue to sort of ask you the question: how do you define personalised healthcare, and how is the Ph360 system helping allied health practitioners to be able to understand that and then
Yep.
take it further and start to incorporate it in or enhance the way that they actually provide support for their own clients.
Yeah, terrific. So essentially, the ways to think about this is the number one thing that we need to do is we need to realize that every single person is an individual. This is something that we know internally, but we don't necessarily take action on it when it comes to the very specifics of what an individual is going to need. And so I guess everything that we're going to be talking about right now, I'll just make sure we've got, excuse me. Everything that we're going to be talking about right now is essentially, well, how do we define people in that very meaningful way and understand what is individual? We firstly have the genetics. There are genes that code for how you're going to process foods, and there's also foods that influence the genes that express. There are exercise genes that are associated with power and lactic acid tolerance and preferences for how we might be motivated or our tolerance to certain intensities of exercise. Genetics actually account for over 50% of our personality, or around 50% of our personality, and are a greater factor collectively than anything else put together. We have genetics that relate to our timing of our day and our chronorhythms, and we have genes that also relate to how we're going to tolerate medications and in what dose. And so this is where it gets kind of complex to say, right, well, there's a lot of genes in play here. There's a lot of different factors that I could use to influence them. Where do I go? Because some of these behavioral genetics are actually genes that are associated with mitochondrial function, which don't logically go together unless you're very familiar with those biochemical pathways and how the system works in total. And so some things that we need to understand about the genes. Firstly, it isn't as simple as single genes, single nucleotide polymorphisms. Each gene can actually code for different things within the body. For example, this one gene right here can code for blindness in the eye tissue, liver failure, or heart disease. So this one gene doesn't just do one thing, it does a few things. And then we have gene-to-gene interaction, and something like schizophrenia is what we call a polygenic disorder, where there's lots of genes associated with schizophrenia. However, if you isolate one of those genes, it has very, very little effect. But if you can identify lots of them and treat all of them, then you're much more likely to have an effect. So we have this incredible complexity that's going on, and consider that there are literally millions of single nucleotide polymorphisms and variations. It becomes an incredibly complex system. And this idea that phenotype is also incredibly important. And it may be more important because irrespective of the genes here, if you look at these two individuals, what would you say? The question to ask is, would you give them the same treatment? Are they going to need the same thing? And I would say from an exercise, nutrition, psychological point of view, even environmental point of view, these people are going to need different things, but they are genetically identical, or identical twins. So what the genetic information provides you is a risk profile. If you've got a hemochromatosis gene, it gives you a risk of getting hemochromatosis. But if your phenotype, your gene expression is saying you don't have high iron stores right now, for example, then that gene hasn't expressed. But we would investigate iron levels as a potential if there was some liver failure or cardiovascular disease going on, because high iron is related to those things, and the genes can point us in that direction as to what might be associated with that condition. So the phenotype, actually what the genes are expressing, is what's so important. And this is exactly what we're talking about here, where we have the genes and how they interact with the environment, the epigenetics, the stuff around the genes, and that influences our phenotype. That is what the end product of this gene expression. And so when we're truly talking about what precise personalization is, we've got this bloke right here with lots of cardiovascular risk factors. We've got 5 meals per day, whole foods, happy days, brown eyes, brown hair, which might seem a little bit irrelevant, but actually they're quite relevant. So the questions that we need to be asking when we're looking at personalization is, what are the potential genes driving this, and are they currently active? So what is the phenotype saying? If we understand the phenotype, then we get a really good understanding of what genes are being expressed. Now, what's really interesting about that is brown eyes and brown hair, for example, are associated with genes and can are a proxy for certain vitamin D genes and how we're going to regulate sunlight and calcium metabolism based on the genes that this pleiotropic nature of what creates brown eyes and brown hair also have an influence on how we receive light and things that regulate vitamin D for a number of reasons. So we need to understand, what are the genes that are active right now? What are the factors that influence those genetic expressions? So what nutrients specifically are we after? Are we after influencing methylation pathways to calm anxiety or support depression, or to support healing, or is it to reduce the risk of blood clots? What exercise is going to be best for this individual? Is it strength training? Is it their body's more accustomed to lighter weight, higher rep? Is it that their body needs more exercise in the afternoon or the evening? All of these things are related to the gene expression of different hormones and the balance of this body. And not to mention, when is their mind going to be most functional? What parts of their biology are driving behavior? Are they competitive? What do these interventions do to other aspects of their body? So if we're going to put a food in, is that going to influence exercise? Is it going to influence sleep? We might put caffeine in to support alertness through the day, but that influences sleep and might also influence our mental state. So for this individual, what's going to be most appropriate? How do they need it communicated to them? People have a preference on what is going to be the best way to communicate this information. What's their best support structure? Do they need regular consultations? Do they need a competitive, challenging type effect, or do they need time and space to think about things? Do they need people around them to really make it happen, or are they autonomous? All of these things have to be considered, and they are driven by the biology. And so as they implement this, their phenotype will change, which means the intervention needs to change. Someone who reduces their fatty liver now can tolerate different foods. Someone who is now exercising more than they were before can tolerate different amounts of protein and different types of exercise, and might think differently about the way that they interact too. So in order to really have this discussion around personalization, we need to understand, who is this person? And this person is defined not only by their genes, which we've discussed, but probably more importantly, what genes are they expressing right now, and what have they been expressing throughout their life to bring them to this point? And so that's ultimately, a lot of this creates an information distraction. Just as I've gone through some things right there, you might be familiar with some things, but not so familiar with other things. And as a result, you're thinking, God, how many things do I need to consider when I'm actually going into a consultation? I just want to stay in my box. I just want to be able to do my thing, provide the nutrients that I need. And that's exactly what we believe as well. And that is, you should be spending a lot more time focusing in the areas that you are very specialized, but also really supporting the client. And so tech is really where the solution comes in. And just to really take this into how we use some of that technology, I'd love to give you a little bit of a history of how technology has really changed our clinical decision-making in the past, stuff that we take for granted. So we have HealthTech. It started maybe as a magnifying glass, which we were just looking at bugs that we could see on the skin. We then moved to a microscope, which was a far more powerful way of understanding bacteria and the integrity and shape of cells, and maybe even some of the organelles within cells. And we've gone from there to electronic methods and full spectrum assays that allow us to process a huge amount of data for our clinical decision making. We can send off a full panel of bloods and genetic panels and all of these other things, and get that back in a very short period of time. And rather than relying on on phenotype and signs and symptoms, we can actually get quantified numbers based on technology. We then, wanted to have a better look into the body, or at the body, and we can actually see directly into the body now with things like CT scans, X-rays, MRIs, functional MRIs, as things are moving, ultrasounds. These also help clinical decision-making, because if you don't have an ultrasound of a baby, we're guessing how big it is, how well it's developing. If we can't get a good MRI of a joint, then we may not know what injury. And so we spend a lot of time in surgery finding out what's going on, and we can't, and it takes a lot longer, and there's a lot more damage to that tissue as a result. We've got things that support us with nutrition, like food databases and handheld devices that allow us to do the same thing. We can do incredible load monitoring, posture analysis from the exercise point of view. We've got clinical tools online where you can put in your data that you've processed with technology, like your blood results. You can throw it in and it'll give you a cardiovascular score over the next 10 years. And doctors use this to predict cardiovascular risk rather than having them to process it in their mind themselves. We're using technology all the time. And it's essentially every advancement that we've made has allowed you as clinicians and us as clinicians to make better decisions and allow more patient time, patient or client care time, which allows us to embed the changes far more effectively. And that's really where it's at. And so where the next generation of technology comes in is we need to understand the individual and their environment in its entirety. We need to understand things like phenotypology and hormones and neuroscience, and we need to understand how their lifestyle is interacting with this. We need to know who this person is and how they've developed, and what are they doing right now, and how is their body indicating that change. And this is what's really exciting about new health tech, and this is what's really great, essentially, is that but in order for it to work, it has to be accessible and affordable. It can't be something that's only available to boutique premium services. We need to understand the body as a whole. There's no point getting a good posture analysis if we're not understanding all of the other structures that are happening within the body, how that body generates energy, is motivated to move. We need to understand all of those different things in order to be most useful. And this is where technology is incredibly powerful at crunching that data and going through it. And so there are a number of different platforms that are available right now. And the one I've been working with both in a research setting and a clinical practice and educating health professionals is with Ph360. And it is a clear leader in applied epigenetics and systems biology, that is understanding the body as a whole, but also being very sensitive to the specifics of what an individual needs. And so our journey through this, we did 10 years of R&D looking at 10,000 different subjects, how their genes and hormones and signs and symptoms interplayed. We developed incredibly complex algorithms with over 10,000 data points that we can measure in around about 30 minutes in clinic, which is really exciting, and soon in around about 10 minutes, which is very exciting as well, the benefits of tech. We ran our first health professional training in 2015, and since then we've trained over 1,000 health professionals working in different continents around the world, and also working with some incredible universities locally and also abroad. So it's been a really wonderful journey in supporting health professionals to bring technology and personalized health into their practice, so that there's all of that data that we spoke about, their genetics and their state and traits, they can actually be assessed very accurately using this technology, so that the clinical decision making is shortened up. And the way that we make this affordable and accessible is through understanding, firstly, anthropometry. And there's the genetics investigation of anthropometric traits. This is a database that understands if you've got a certain body structure, it represents certain genes and clusters of genes. So by understanding the outside of the body, we can actually understand the inside of the body. There's genes associated with trunk length and limb size, our height, our weight, our waist to hip ratio, all associated with genetics as well. So we can understand the outside of the body, and it helps us navigate the genetics. We also know that hair color, eye color, skin tone, your genetic lineage, and also features like this is relevant to a particular collagen gene. We know that there are phenotype traits that relate to genotype. And so this is what makes this kind of technology so accessible to people, is that you don't need to send genetic samples off. You can actually measure genetic proxies and also gene expression from the outside of the body, from very specific phenotypic traits, from an evidence-based database. And so 20 years on, what we've done with those 10,000 data points is that we're able to give an individual a summary of where their body's sitting right now. We can map these characteristics that we see phenotypically back to their single nucleotide polymorphisms, back to the genes, back to the chromosomes. So essentially, by understanding the outside of the body, just like that the two women, one who had a greater body mass and the other with a smaller body mass. We can understand the outside of the body, but when we do that intelligently, we can actually then navigate into the very specifics of the genes that this person has, which then informs nutrigenomics, exercise genomics, behavioral genetics, and also exposomics and the study of how we respond to the environment, temperature, cold, climate, season. All of these things have an influence on our genes as well. And so this is all put together for the health professional and the user so that you have an application where you can complete those assessments. All of it auto-populates into the app, and then they're provided epigenetic-specific outputs that support your clinical decision-making. For an individual, it's quite hard to determine, how much oxalic acid can they actually tolerate, and then calculating all of the foods that actually come into that. Well, we understand that if they've got a phenotype of more kidney stones or greater risk of kidney stones, then we can automatically, the algorithm automatically adjusts for reducing the oxalate foods down so that they're provided food suggestions that aren't going to be contraindicated for their body. We have the same thing for exercises and the type of exercise that are going to be best for them, even how the environment works with their body. Some people are very tolerant of air conditioning. Other people, it's quite detrimental for their resilience and their stress. And so this application then acts like an extra brain for the clinician, where they can understand, right, what are the things that, this is the information that's going to be relevant for this individual. Now, how can I then best motivate them? And the health professional training that we do essentially allows you to navigate this application. There's a coaching panel access to this for health professionals. So you can say, right, this is their behavioral genetics. This is how it's going to play out. This is how they're going to be motivated. These are the types of things that I need to consider with explanations. And so the user sees an experience like this. What are the best exercises for me? What are the best vegetables for me right now at this time of year in my current state of health? Because we know that as a person gets fitter, sicker, stronger, larger, whatever it may be, their hormones change, their gene expression changes, the nutrients they need is also going to change as well. And so it provides very, very specific information for that individual that the health professional can then leverage to maximize their behavior change and maximize their results. And so what we've done, obviously, and this is some really great data that's being processed at the moment that we drew down from our data set of just a subset of 1,700 people with some cardiovascular risk factors and type 2 diabetes risk factors. And overall, in 100 days, we see a 30% reduction in these factors. And at 600 days, it was maintained. So this is really exciting data. Is when you apply this information, we start seeing some immediate change. This is unassisted. However, with health professional assistance, these results are far greater, and our ability to reverse in all clients becomes possible if we're supporting them along the way as well. We also did some studies, particularly in corporate populations, and we were looking at how their stress, depression, and anxiety risk were influenced by following a personalized profile. And essentially what we saw in a 30-day period, we saw 96% of individuals experience a benefit or maintain a healthy status of stress, depression, anxiety scores are based on the DAS-21. So not only do we see this incredible change in body composition, cardiovascular and metabolic syndrome risk factors, but at a group level, we see the same thing for mental health as well, because mental health is very much governed by physical health and also mental processes and psychological phenomena. But those two have to come together, and this is what's so important about that systems biology piece and understanding the whole individual. So with the tech, essentially what the result is we have a practitioner working with a client that uses an extra brain, which is calculating incredible amounts of data incredibly quickly, and is then able to provide very specific advice for an individual. And it might be for one person, this person's prone to osteoporosis and degeneration of joints and muscle tissue. They've got higher levels of introversion and conscientiousness. They've got higher carbohydrate tolerance. They've got a more sensitive digestion, and they're going to need specific foods, and it will then populate with those foods that are going to be most accepted by their body. It's even going to be talking about the types of exercises that are best. And all of this comes along with education for health professionals so that you can be a real authority on this information that comes out of the technology. So the decision-making gets crunched. You understand the rationale of the decision-making so that you can communicate it and support it without having to do all the heavy lifting of going in and doing extensive studies on genetics and hormone levels and psychological traits and how a body is built. Whereas we might have another body that is going to be produced with a very, very different protocol. Instead of regular meals over here with higher carbohydrates, what we have here is a body that's at greater risk of type 2 diabetes, a greater propensity for weight gain, lower carbohydrate and protein requirements, and it'll indicate that within the application, 2 to 3 meals per day versus 5 meals per day, heavy strength training. So instead of thinking, oh God, there's so many different things that I could apply to this individual, what is the thing that's going to put this individual into their best state that matches their genetics and also their genetic expression right now? So this real-time extra brain that you acquire allows you then to spend an incredible amount of time motivating, supporting, and providing that clinical experience, which is what's so important to evidence-based practice. It is the research with the clinical experience, with the patient experience as well. These things all have to come into account for good evidence-based practice. And so essentially, this is what we are here for at Ph360 Edu. We are here to support health and fitness professionals to live their potential. That is our mission. We want you to be in the best possible state that you can be healthfully. We want you to have a business that is successful and is thriving and is having the greatest possible impact on clients. And we don't want you to be having an experience where there's 30 to 40% of people who aren't getting a result, or even 20% or 10%. We want to be able to provide you a solution and a support that enables you to provide precise information to each person that you are likely to see in your practice, and help them understand their body in a comprehensive way rather than just within your line of profession. You're able to have assistance from health professionals from around the world of all different silos of health sciences, so that you can really deliver a much more comprehensive intervention for any individual. And so what I would say is if you're looking for more information and looking for some of these resources and to read more, we have free evidence-based resources, medical health professional and medical courses, some free, some paid. And you can find out plenty of information at that website right there. But ultimately, I guess, and to really help you understand what can be done in this space, there's an 8-week Ph360 Mastery Series, which essentially is designed for you to understand the principles of personalization, but specifically so that you can take advantage and use this tool in your practice to enhance your clinical decision-making, so that you can spend a lot more time helping people get a result with the right information rather than going through a trial and error process. And so we provide an incredible amount of support, 20 plus hours of assessed professional development for allied health and soon to be medical professionals as well. And this is essentially the things that you will learn are the personalized sciences of genetics, epigenetics, phenotypology, endocrinology, hormones, semiotics, which is signs and symptoms, chronobiology and circadian rhythms, neuropsychology, nutrigenomics, exercise genomics, exposomics, geomedicine. Essentially, in order for us to support you in having the greatest understanding of what the technology can do, these are the areas that we need to support you on. But what's really incredible about this is you can use the insights from the application knowing that this science is incorporated into it, and then continue to gather ongoing professional development, which helps support you grow and develop professionally. And so the platform you will also receive access to as a health professional. It's got 25,000 personalized recipes, exercise principles, programs and classes, chronobiology, personalized push notifications, and specific access for you as a coach. And all of this is designed specifically so that you can work within your area of specialty, be supported by other practitioners that are in their specialty as well, and then take that not just into your clinic or into your practice, into your gym if you're working there. It might be that you want to take this into corporate wellness, into schools, into gyms, wherever it may be. You're able to use this technology to help you scale an intervention so that everybody can actually have access to what's exactly right for them, and you support them through that process. We have, in some cases, 2 practitioners can support 80 people through a group program very easily with the use of this technology. So it doesn't only provide you that extra brain, that superpower that allows you to understand, what are the best environmental elements that are relevant for the person and for their condition, but also to do that at scale and to be able to have more impact in what you're doing as well. If you like working one-on-one though, then there's incredible premium packages that you can design so that you can really support an individual to reach their best health, knowing what's right for them. So with all of this, I guess, if you are interested in more information, the Ph360 Mastery Series, it's the premier 8-week course. It's self-paced and has a combination of live, online, facilitated content as well. And it is designed specifically for you to enhance your clinical decision-making and create a better result for every client. You to understand every single client that comes by, understand what's going to drive their result, so that the guesswork is taken out, so that you can apply your clinical expertise and clinical experience to really driving the best result for them. And as part of being involved with HealthTech X and also Core Plus, we're just thrilled to be able to offer you a 60% off. And this is an evergreen offer for you, where you can, if you're coming through Core Plus and HealthTech or HealthTech X, you'll have that available to you. We want to make this affordable and accessible to every single health professional on the planet. And you can follow that link there to find out more about that and getting involved in it. So make sure that when you are registering, that you let us know that you've come from Core Plus. There'll be a little tile there as well that allows you to click on that and go to exactly and make sure that you've come through Core Plus and HealthTech X, so we know that we can support you as part of this community. And essentially, I guess just I've sort of gone on with this, Yianni, and I got really excited. But the reason that we're talking about this is this idea of our clients interacting with technology is an inevitability. It is happening. There is health tech that is coming around the world. It is publicly accessible right now. In 5 or so years, they will literally be Googling their own profile, essentially Googling their own profile and understanding what's the exact foods that I need for my body. And there'll be machine learning and deep learning programs that will be able to bring up a solution that a human brain can just not process that quickly. The way that technology is going to be interacting with our health is profound. And very soon there'll be augmented reality where we'll be walking down the street and our glasses will be telling us, hey, you've got a meeting coming up, but from your wearables, your heart rate variability has been slightly stressed for the last couple of hours. You need to really chill out. I'm going to play some music that's going to specifically support the neural elements that you need to calm down. I'm also going to order a green tea from the cafe that's on the way to this meeting that you're going to, so you can pick that up on the way, because that's going to really support your brain right now. And it's recommended that you take some time after the meeting because your stress score for the week has elevated a little bit too high. Like, this is what technology is going to be doing. In fact, it's already coded in some of these programs and definitely ours. This is coming. What we're going to have access to is mind-blowing. What you need to do as a health professional is embrace this. Just like you embrace an MRI when you've done a ligament in your knee, it's far easier checking an MRI than trying to guess from the outside. And this is essentially what technology provides us, is that insight into the body. And the new wave, and that Ph360 is really leading, is this in-depth insight into the body that has never been seen before, that allows a specificity and precision that is about eliminating chronic disease and pain by the year 2050. And that is our mission. That is our goal. And we know that talking to this group, this is exactly what you're in the game for. That's provide people an opportunity to live their best life, through knowledge and support. And we have to do this in conjunction with technology. It makes the journey a lot faster, and it's something that our clients will be asking for if they aren't already. So thank you, I guess. And Yianni, if you have any other questions, I'd love to answer them. But ultimately, it's just an absolute pleasure to be talking to you.
Thanks, Dr. Cam. That was great. No, you've definitely addressed a lot of the questions that I had lined up for you, and it's really fascinating. I really concur with how the digital health movement is propagating, and it's really infusing itself into the modern healthcare setting. And I think it's really important to as a health provider to actually understand that your clients, the consumers, are probably interacting with some of these digital health ideas on their own, but they're not equipped with the background, the expertise that is within a health professional. And so, bringing those two things together is really key, I think, to getting the most out of digital health. And we've seen it in the app markets. There are a lot of tools out there that aim directly at consumers, and they generally don't do as well. They might get some initial downloads and interactions, but having the relationship between the healthcare professional and the technology, I think, is actually key. It's more holistic, and it allows that relationship and that engagement, that cooperation, that partnership, if you will, to be cultivated long term, so that it's not just about the service that's provided during an appointment, but it's also about what happens in between the appointments. And it really engenders that long-term relationship between a consumer and their health provider. And we're seeing some pretty amazing stuff. You talk about machine learning and AI and the like within the HealthTech X ecosystem at the moment. There's some great ideas that are coming out. But what you're doing here, Dr. Cam, is you're now working with allied healthcare professionals, and that's quite a broad term, but the list that I'm aware of, at least, and I just want to sort of point out, is you're currently working with dietitians and nutritionists, with naturopaths, with exercise physiologists, psychologists, social workers and counselors, psychotherapists, nurses and practice nurses, diabetes educators, osteopaths, physiotherapists, chiropractors, occupational therapists, to name a few. So very broadly represented within the Core Plus community as well. And I know you also have a strong contingent there of researchers and a scientific community that's helping inform some of the program development as it goes forward. Probably one of the questions that I wanted to, perhaps from my mind, just help me come to terms with the system that a health professional would get access to. Would you mind giving us perhaps a very high-level understanding of how they bring the Ph360 system into their health profession, aside from obviously attending the education and the support and the mastery series that you've offered? But what's it going to be like in the field for them when they have gone through those courses and built that professional development and become, graduates, I guess, of the mastery series?
Yeah, fantastic. So probably the mastery series is specifically designed to train exactly that. And what that means for the practice of it is, once a person has come through the course, even halfway through the course after phase 2 of 3 phases, they'll be equipped to say, hey, let's say that you're a dietitian, or you're a type of a practitioner that brings someone in for an individual consultation. What you'll be able to do is run your normal individual consultation, but then be able to stack on this Ph360 assessment, which by the time that you're doing it, it may be 10 to 15 minutes in total for them to be fully assessed. At that point, you have a live application, and you also understand, based on the information you provided, understand about their behaviors and how they're going to be driven. So straight away, as soon as that's complete, you're going to run your normal initial consultation, but now you're going to be able to speak to them in a language that's relevant to them. You're also going to know immediately, okay, well, we've got this type of expression, and the top priority for this type of person is this, this, and this. So I'm actually, the first bit of homework that I'm going to set is going to be very, very specific to them as well. So generally, it doesn't really disrupt. It's just like another piece of your history. You just get the data, and then you're then using that to then inform everything that you do forward. But often we say that there's a minimum of 3 sessions when you onboard someone into Ph360. We go for an initial consultation where you're understanding why they're there and their ailments and their history, and you do the assessment at that point. You then bring them back for a delivery session where you're talking about, this is the intervention we're going to go forward with. This is what I'm going to provide to you. This is what your application is saying. This is how you can really take advantage of it. And then the third session is, how did you go with that? Let's start coaching. Let's start motivating you. Let's make sure that you're doing these things. And we know that anyone who really wants a result, you need to onboard a person well, understand them well, onboard them well, and coach them well. And if you have validated yourself as a great person who can motivate and support them to make change, that's going to lead to much longer relationships as well. And we specialize in personalized behavior change, personalized behavioral language and communication. And we have incredible practitioners that specialize in that field, psychologists, social workers, who have developed an incredible curriculum around how you can support a client long-term, get them the best result possible, but also really support your business too. And just one other piece as well is that this becomes a service that you can either profit from or just pass on the cost price. So you can access, as a practitioner, you can access the platform for a reduced price than what a patient would normally pay at retail, and that then allows you to add some profit to that, or you can pass on the discount that a coach gets and not make any money out of it. But ultimately, we know that this service is valuable, and we really support health professionals in understanding their value too, and really upskilling their business. And we have a whole track of professional development in business skills and making sure that you're actually ready to go out there and improve how you're remunerating yourself and supporting your life while that you're changing so many lives.
That's fantastic. So I guess the summary I take away from that is that the system overall has a process for doing a kind of an initial assessment that is looking to measure those gene expressions and help the healthcare professional to be able to not just take those measurements, take that feedback, take that information, but then be able to incorporate that into an appropriate communication style based on the type of the best way that would be optimized for that person, based on what the system has understood and profiled them relative to, I guess, that science-backed approach to, different body types need different types of communication styles, different types of nutritional approaches, different types of approaches to exercise, as an example. So that all goes towards understanding the, I think when I was talking to you prior to coming into this, you were talking about understanding the biology of the client's behavior. And then by better understanding that, you're able to then talk to them and put an approach together that will really be optimized to suit them, and hence the personalized healthcare approach. Is that sort of a fair summary?
100%, and you'll know it. Some people just want a challenge from you. Other people are like, just give me one thing at a time. There's a biological mandate that's happening in their body that's governing a lot of that preference. And so if you understand that straight away, the people that you can push, the people that you've got to give more time to, the people who are going to get overwhelmed with information, the people who are going to digest everything that you've given and ask for more. That is very, very predictable based on how the profile comes out and all of their various elements to their body and mind. So that piece right there is instrumental in delivery and communication to make sure it lands with people, maintaining your business and your client base, how you communicate in all ways with them, and how they then go on and impact people in their sphere as well. So it's incredibly important that we understand really who this person is.
Fantastic. And this conforms with continuous professional development and other types of membership-based or registration support as well?
That's right. Yeah. So we have ultimately many of the organizations now, they allow their own health professionals to determine what is professional development. But at the same time, we're actually talking to each of the health professions and talking about how they incorporate this information in, how they provide accreditation for it. But essentially, this is an assessed program, and most organizations require some sort of assessment in order for it to be a certain level of professional development. Everything that we do is evidence-based, and that also flows through in the ongoing professional development as well, in exercise, manual therapies, food, mind, and also medical that we have running too. So that, and getting involved with the whole community and having that resource of other health professionals around, it makes it for a really nice place to be able to gather a whole lot of professional development and network.
Fantastic. All right. Well, what I've done there is I've just posted into the chat the links through to the special offer for the Core Plus community and the HealthTech X community. Thank you so much, Dr. Cam, for putting that through. And we did have a couple of questions during your presentation, which you've covered off. They were around honing in on what personalised healthcare compared with concepts like client-centred healthcare, and I think you did a good job with covering that off, and how to bring that epigenetics approach into practice. So I think the systemization that you've done with Ph360 is precisely that, yes. And it's something that is not necessarily a radical departure on concepts that are already known within healthcare, but this is actually putting a system now designed to be very tailored and specific around the individual client's needs and what's going to be optimal to get them to the outcome that that they're looking for.
Exactly. So, right. It cuts through a whole lot of thinking. No, it just cuts through a whole lot of thinking and allows you to really stand on the shoulders of giants. That's very much what it's designed to do.
Oh, that's great. And I think just that's kind of just triggered something else that had occurred to me while you were talking, is that Ph360, you and your team, you're doing a tremendous amount of effort in consolidating the most up-to-date science and research around this. And that would be hard, wouldn't it, for an individual healthcare provider to be trying to keep up with the latest and greatest information and how that goes. So I think that's kind of an understated part of, I think, what is really super valuable in your system. It's actually, yes, in a way, delegating or having a partner there who is doing that heavy lifting and staying, abreast of all the updated information, and not only being able to impart that and share that with the community, the Ph360 community, but also then modify the application, the health tech, and the system to meet, I guess, the best possible way to help somebody going forward. Is that sort of a fair summary?
100%. Yeah, we're there was a change. There was a whole lot of new research on polyphenolic compounds and the influence they have on health. And with integration into the platform, we're in 128 countries with the platform right now. We can essentially re-optimize everybody's food list based on the latest evidence. And so overnight, we were able to update people's food lists based on the most recent evidence, which is something that no clinician can do in a systematic way. To do that across polyphenolic compounds and then all of the other nutrients that we have and how that interacts with each different person in each different region, to be able to provide that information, this is where we can really take advantage of an incredible resource and people who are dedicated to eliminating disease, supporting you in making better decisions. That's essentially where we sit.
Oh, that's brilliant. Dr. Cam McDonald, thank you so much for coming in, and thanks for that offer to our respective community. Greatly appreciated. Have a great day, mate. I look forward to catching up to you soon.
Thanks so much, Yianni.